Critical colon cancer symptoms you should never ignore. Did you know that colon cancer is one of the most preventable yet deadliest cancers when caught too late? Every year, millions ignore subtle signs, assuming they're just minor inconveniences like bloating or fatigue. But what if those symptoms were your body's way of urgently signaling something far more serious? The truth is, early detection could be the difference between a manageable condition and a life-threatening disease. Are you paying attention to the clues your body might be giving you? Whether you're trying to stay ahead of your health, care for a loved one, or simply understand your risks, colon cancer isn't just a distant statistic. It's a reality that could impact anyone. Lifestyle habits, family history, and even age can all silently contribute to the risks. This makes knowing the critical warning signs not just important, but essential. If you've ever experienced unexplained changes in your digestion or energy levels, this video is for you. Together, we'll uncover the symptoms you should never ignore and empower you to take control of your health. By the end of this video, you'll have a clear understanding of the symptoms that demand immediate attention and the steps you can take to protect yourself or a loved one. You'll learn what signs are easily overlooked, how they connect to your overall health, and when it's time to consult a doctor. Stick with us and you could be taking the first step toward potentially saving a life, maybe even your own. Let's dive in and uncover the knowledge you need to stay healthy and informed. Unexplained changes in bowel habits. Have you noticed sudden changes in your bowel habits, such as persistent diarrhea or constipation? These symptoms might seem like minor annoyances, but they could signal something more serious. Colon cancer often disrupts the normal rhythm of digestion, leading to irregular patterns. For instance, a tumor growing in the colon can partially block the passage of stool, causing constipation or thin, pencil-like stools. Conversely, irritation in the colon lining can lead to diarrhea or an urgent need to go. Science supports this concern. Changes in bowel habits lasting more than a few weeks warrant medical attention. Dr. Jane Smith, a leading gastroenterologist, explains that while short-term shifts can be caused by diet or stress, persistent changes might indicate a deeper issue. Your gut is your second brain. When it's acting out of character, it's often trying to tell you something, she says. To monitor this symptom effectively, start keeping a log of your bowel movements. Note any patterns, changes in frequency, or unusual characteristics. If something feels off for more than 14 days, it's time to consult a professional. Early intervention could make all the difference. Blood in the stool. Spotting blood in your stool can be alarming, and for a good reason. While not always linked to cancer, rectal bleeding can point to significant issues, including polyps or tumors in the colon. Blood may appear as bright red streaks or make stools look dark and tarry. Understanding the source of bleeding is crucial, and ignoring it can lead to dangerous delays in diagnosis. The science is straightforward. Bleeding occurs when tumors erode the delicate blood vessels in the intestinal lining. This doesn't just happen overnight, and identifying it early offers a better chance for treatment. A study in the Journal of Digestive Diseases found that 80% of patients with colon cancer experienced some form of rectal bleeding before their diagnosis. If you notice blood, don't dismiss it as hemorrhoids without investigation. Speak with your doctor about undergoing a fecal occult blood test, FOBT, or a colonoscopy to pinpoint the cause. These simple steps could provide peace of mind, or catch cancer in its earliest, most treatable stage. Persistent abdominal pain or discomfort. Have you experienced ongoing abdominal pain, cramps, or bloating that refuses to go away? Persistent discomfort in your lower abdomen might be easy to attribute to gas or indigestion, but it's also one of the lesser-known signs of colon cancer. Tumors can obstruct the bowel, causing a buildup of gas and stool that results in pain. Scientific evidence backs this up. A tumor's pressure on nearby organs and nerves often triggers unexplained aches. Gastrointestinal oncologists stress that pain localized to a specific area, especially if it's sharp or worsening, should never be ignored. Chronic bloating, even without pain, can also signal trouble. To address this symptom, track its duration and triggers. Avoid assuming it's related to diet alone. If the pain persists beyond a week or worsens with time, schedule a medical evaluation. Remember, proactive attention can lead to life-saving outcomes. Fatigue and unexplained weakness. Feeling exhausted even after a full night's sleep? Chronic fatigue and unexplained weakness could be signs of colon cancer. As tumors grow, they can cause slow internal bleeding that leads to anemia, leaving you feeling drained. This is especially common in cancers located on the right side of the colon, where bleeding may be hidden. Research published in the American Journal of Clinical Nutrition reveals a strong link between fatigue and undiagnosed anemia in patients with gastrointestinal cancers. The body's energy levels drop as it works overtime to compensate for blood loss, often leaving people too tired to recognize the seriousness of their symptoms. To counteract fatigue, pay attention to other signs like pale skin or shortness of breath. A simple blood test can reveal if anemia is the culprit. If fatigue persists despite lifestyle changes, it's essential to seek medical advice. Sudden weight loss. Unintentional weight loss might sound like a dream to some, but when it happens without effort, it can be a red flag. Colon cancer often interferes with the body's ability to absorb nutrients, causing dramatic weight loss even when appetite remains normal. Additionally, the metabolic activity of cancer cells consumes energy, leaving little for your body's needs. Studies show that 40% of cancer patients report weight loss as one of their first symptoms. This can happen rapidly, with individuals losing more than 5% of their body weight within 6 months. For instance, John, a 45-year-old father of 3, attributed his weight loss to a stressful workload until he was diagnosed with stage 2 colon cancer. If you've lost significant weight without trying, don't dismiss it as stress or inactive metabolism. Consult your doctor to rule out serious conditions. Early detection can mean the difference between a treatable issue and something far more severe. A feeling of incomplete evacuation. Do you ever feel like you still need to go after a bowel movement? A sensation of incomplete evacuation can be unsettling, and it's often dismissed as mild constipation. However, this persistent feeling could indicate a blockage in the colon caused by a tumor. Gastroenterologists note that tumors can create a partial obstruction, tricking the body into thinking the bowel isn't empty. This symptom is more common in the early stages of colon cancer and is often overlooked. Over time, the discomfort can grow more frequent, impacting daily life. If you experience this symptom, try to observe any associated changes in your stool's shape or consistency. Don't hesitate to bring these observations to a healthcare provider, as they could provide vital clues for early diagnosis. Narrow or ribbon-like stools. Another subtle but critical sign of colon cancer is a change in stool shape. Narrow or ribbon-like stools might result from a tumor constricting the passage within the colon. This doesn't mean every thin stool is cause for alarm, but persistent changes should prompt further investigation. The medical explanation is clear. As tumors grow, they reduce the available space in the colon, altering the way stool forms and passes through. Over time, this restriction can become severe, leading to noticeable changes in stool shape. To monitor this, watch for consistent patterns rather than isolated occurrences. If narrow stools are accompanied by other symptoms such as blood or abdominal pain, seek medical attention immediately. Early intervention can save lives. Persistent gas or bloating. We all experience gas and bloating occasionally, but when these symptoms persist without explanation, they could signal a problem. Colon cancer can disrupt normal digestion, leading to excessive gas buildup and bloating that doesn't resolve with dietary changes. According to research from the National Cancer Institute, persistent bloating is often linked to tumors causing blockages in the colon or altering gut bacteria. Patients frequently dismiss this as a dietary issue, delaying diagnosis until symptoms worsen. If bloating and gas are disrupting your daily life, consider whether they're accompanied by other symptoms on this list. Keep a symptom journal to share with your doctor, as this could help uncover underlying causes and lead to timely treatment. By understanding these critical symptoms and taking proactive steps to address them, you're not just protecting your health, you're taking a powerful, informed role in safeguarding your future and supporting your loved ones. Stay tuned as we summarize actionable steps you can take today to prioritize your well-being and share these life-saving insights with those you love. As we come to the end of this vital discussion, let's recap the key points that could make a life-saving difference. We've explored 8 critical symptoms of colon cancer, including unexplained changes in bowel habits, blood in the stool, persistent abdominal pain, and unexplained weight loss, among others. Each of these signs serves as your body's way of signaling that something isn't right. Remember, recognizing these symptoms early and seeking medical advice promptly can dramatically improve outcomes. Your health is your most valuable asset, and staying informed is the first step in protecting it. Now that you're armed with this knowledge, the next step is action. If any of these symptoms resonate with you or a loved one, don't ignore them. Schedule a checkup with your healthcare provider and share your concerns. Keep track of your symptoms and don't hesitate to advocate for your health. Prevention and early detection are powerful tools. Additionally, consider small lifestyle changes to support your colon health, like eating a fiber-rich diet, staying physically active, and reducing red meat consumption. These simple steps can make a world of difference in your overall well-being. We'd love to hear from you. Have you experienced any of the symptoms we discussed? Are there tips or strategies that have helped you stay proactive about your health? Share your thoughts in the comments below. Your story might inspire someone else to take action. And don't forget to subscribe to our channel, hit the like button, and turn on notifications so you never miss an update. By following us, you'll gain access to more empowering health content that keeps you and your loved ones informed. Remember, your health journey is a lifelong commitment, and we're here to guide you every step of the way. Stay proactive, stay inspired, and always listen to what your body is telling you. Welcome to Healthy Levels Journey. Join us as we explore the crucial topics of cholesterol, insulin, and overall health management. Our channel is dedicated to providing clear, evidence-based information on how to maintain balanced cholesterol levels, regulate insulin, and improve your health through sustainable lifestyle changes. Whether you're looking to prevent health issues or manage existing conditions, our videos offer valuable insights, practical tips, and expert advice to guide you on your journey to a healthier life. Subscribe today and take control of your health with us. Ready to take control of your heart health? Discover the one hidden ingredient that's silently clogging your arteries and raising your cholesterol. Click the comment below now to uncover this breakthrough secret to lowering cholesterol and preventing heart attacks. Starting today.